Hi everyone. So I'm with Kirsty today, and for Diabetes Week 2022, we thought we'd take a little bit of time to have a chat about how we approach type 2 diabetes prevention, treatment, and remission as allied health professionals. How are you going, Kirsty?
I'm well, thanks, Danielle.
That's good. Did you want to sort of tell us a bit about what we do from the MHS perspective?
Absolutely. So we have the pleasure of being in quite a unique position for ourselves with access to some gold standard technology, including metabolism testing to help manage this diabetes, which has enabled us to have some really good experience with these patients and some successes too, which we'll touch on in a moment as well. And we just aim to help increase awareness of people's options out there and the possibilities in terms of prevention and also that remission that you mentioned before, because ultimately we should be able to make an informed choice to take back control of our health. Definitely. And all the other little things that come along with it as well.
Absolutely. All right, so now to kick things off, I might talk a little bit about type 2 diabetes prevention, which is something that I've come to have quite a bit of experience with over the years. So typically when someone comes to see us with pre-diabetes, or they've been told that they're at risk of developing diabetes, often like a typical case would be they've got elevated insulin levels, maybe their blood sugar levels will be elevated or not. It could be the very early stages that's not happening yet. Sometimes their HbA1c is a bit elevated. Sometimes they've got fatty liver as well. So really interestingly, the fasting insulin and fatty liver, they can be the very early warning signs of developing diabetes, sometimes 10 years before the diabetes actually is diagnosed. You can have those signs in the past. So someone that I saw very recently, so she's done an amazing job, this lady. I mean, obviously this is all de-identified, but basically in her mid to late 20s, came in with those classic signs: difficulty losing weight, things like poor energy levels, and she was really worried about developing diabetes. It ran in her family, and it was something that she definitely wanted to avoid. So we did the metabolism testing. Again, very, very typical signs there with a poor fat burning, poor efficiency, all consistent with insulin resistance. And basically what we did there is using a low carbohydrate, higher protein approach with adequate fats, focusing on getting those essential fatty acids as well, the omega-3s, we're able to bring her insulin down to the normal levels. And basically she doesn't have pre-diabetes anymore. She's lost weight, she's maintained her muscle mass. So that's another really exciting thing with this approach as well. A lot of the times when you look at the literature, the weight loss is often accompanied by about 25 to 30% of that weight coming from muscle. And this lady in particular, she maintained all her muscle mass. She hasn't lost any muscle. So yeah, really exciting results. And it's something that we wouldn't be able to achieve, I don't think, not such great results without using the metabolism testing to help people optimize their metabolic health, to lose weight in that way. So very, very, very encouraging, particularly from a dietitian perspective. And of course, if someone does go on to develop type 2 diabetes, that's not the final sentence either. So Kirsty, do you want to tell us a bit about type 2 diabetes treatment and remission?
Yeah, absolutely. And it sounds like your patient had some really good results. Is you obviously as a passionate practitioner, we can all see that, but hopefully very motivating for the patient and give hope
Absolutely.
to you guys watching as well, because prevention is better than a cure, but as you mentioned, is essentially, even if you are genetically predisposed, there are some things you can do, even if it does get to the point of diabetes. And I like to say that genetic loads a gun, but essentially the lifestyle pulls the trigger. So that's what I'm going to chat about, is those various factors that we do have within our control, which not only helps with the typical patient that you mentioned before, but also those at risk with not only the fatty liver, but the PCOS, and some of those other common conditions, sleep apnea and that might come along with it as well. So first of all, touching on the diet that you mentioned before, a therapeutic carbohydrate load to essentially enable access to fat stores, which works by reducing that insulin, which is key in not only development of diabetes, but also that remission as well. So we've been chatting to a few people about the concept of, why is a diabetic man or woman always hungry? Because they've got plenty of fuel, particularly in terms of fat, but they're not able to switch back to it. So that's what that carbohydrate restriction can do for a lot of people. But by all means, that's not the only thing that we can do. You talked about maintaining muscle before, which really helps with that insulin sensitivity and that blood sugar level regulation and management, which is where something like monitoring the muscle mass, as you said, but also resistance-based training, adequate protein load.
I forgot to mention that one. Yep.
Really comes into it. And then you've also got the likes of some therapeutic adjunct therapies, which might be recommended by a GP, such as GLP-1s, so Ozempic, which we might be familiar with, to really optimize results and cravings. But the big part of the pyramid is that lifestyle. So that's why a lot of GPs, although they're using these therapeutic tools, they're actually still sending patients to us because they recognize the value of the testing in terms of motivating the client, also making sure whether they're on the right track with these adjunct therapies. So we've got a endocrinologist in Singapore who's using this technology to say, hey, what actually is the best therapy for this patient? For some, it might be the Ozempic, but it might just need to be something like metformin or berberine to help with that sensitivity, or whether there's some patients present with some addiction type patterns. So that's maybe where something like Contrave might be more important. But as mentioned, lifestyle really is the best medicine, and that education, that measurement support, we've had feedback from patients being of real value. So, for example, one of the patients that I seen came, he presented on 26 units of insulin, so he was diabetic. Quote him, it was ruining his life. And really good news for this 58-year-old gentleman. So it's not only impacting the young people, can teach an old dog new tricks, which is great. He lost that 10 kilos and less than 20% from muscle, which really helps keep that weight off. But he ceased all insulin in conjunction with his GP.
Amazing.
So that is fantastic, considering he mentioned it was ruining his life. But for him, he was just so excited to tell me about his improved mobility and even some impacts on libido, which we don't like talking about. But this is really why it's quite exciting and why we keep doing what we're doing. Because it's not only about the numbers, it's about that quality of life and all the other areas this lifestyle can bring. He's now got more energy, so he can go for the walks and help maintain his muscle with some resistance-based training and those sorts of things as well. And that was over 9 months, so it's not a short-term fix. But as I say, really exciting times. Hopefully it gives you hope. And if there is anything, just ask next time in clinic, and we'll be following up with an email as well with some of our great stats and also some information that you can follow up with.
Awesome. Thanks, Kirsty. So an excellent message of hope, that there are things that you can do if you've got pre-diabetes, if you've been diagnosed with type 2 diabetes, or if you wanted to look at a remission. These are options that are available to you. And at MHS, we're here to help you through that journey.
Yeah,
So,
absolutely. Thanks so much, Danielle.
thanks, Kirsty.
See you.
Cheers.